Yes. Good afternoon, friends. This is Praman Adhikari from SAPE Secretariat. I'm currently appearing in this screen from Pokhara, Nepal. I would like to welcome all of you to this webinar session on the need for radical changes in our public health system and what South Asian governments should do to achieve the universal goal of right to health for all, as the COVID-19 pandemic has exposed the frail nature of our public health systems. Although uneven across the region, it is already evidenced that the public health system are unable to cope with the current burden of disease. This webinar is fifth session of our webinar series. SAPE in Forum Asia started the webinar series on 20 May 2020. In previous 4 webinar sessions, we had discussions on the issues of data and inequality, plights of migrant and informal sector workers, situation of women's and children's rights in the time of COVID-19 pandemic and its impact. You can visit SAPE and Forum Asia social media pages to see the recorded version of our previous webinars. This webinar is live on Forum Asia Facebook page. Today's session will be moderated by Farooq Tariq. He is based in Lahore, Pakistan. He is an advisor of SAPE and he is associated with many national, regional, and global civil society networks. We have 4 distinguished speakers who are joining us from Afghanistan, Bangladesh, Nepal, and Pakistan. We'll have around an hour of discussions, question answer session, half-hour discussion, and question and answer session after we listen to the deliberations by the speakers. Devendra Adhikari, South Asia Program Manager of Forum Asia, will be concluding the discussions at the end. So we try to complete the webinar in 1.5 hours time. So now I would like to request Farooq to begin the session. Over to Farooq.
Thank you, Praman. I welcome all the participants and the speakers and the organizers to this South Asia Alliance for Poverty Eradication webinar. And this is a series. This is part of series of webinars which SAPE is organizing to raise the consciousness and among the people more awareness about different aspects which they are facing at present time. Now, COVID-19 and the need for radical changes in our public health system in South Asia. That is the main topic today. And we have very good distinguished speakers from 4 countries. So let me introduce them in detail when they will speak. So I will introduce the speakers while they will be speaking. So I would request, first of all, our friend from Afghanistan, Syed Hussain Anosh. Now, Syed Hussain Anosh has worked for the promotion and protection of human rights in Afghanistan from 2012. So he's a leading activist of human rights in Afghanistan. Both his educational background in law, politics, and human rights and professional experience provided him with the opportunity to gain skills, expertise, and qualification to run the civil society and human rights network is called CSHRN in a war-torn country such as Afghanistan. He currently works as the executive director at the Civil Society and Human Rights Network, which is an umbrella organization. Welcome, Anosh, and please start what you have to say on this topic.
Thank you very much for the introduction. First of all, I'd like to thank you, Forum Asia and SAPE, for organizing these events on regional level. And in these trying times, we have come together to talk about our regional issues, which is, of course, the pandemic. COVID-19 has affected everything in all countries. Unfortunately, in Afghanistan, it's like similar to other countries, the other of South Asia, but you can also add another complexity to that, which is war and conflict and violence and terrorism issues. That's why I named my presentation Fragile Health System Coupled with the COVID-19 have brought the most needy at severe vulnerability. In Afghanistan, we have very fragile health system. The government is not really able to provide the health system properly in the country, and it was coupled with the COVID-19 when the COVID-19 started. So my discussion will be focused on 4 pillars today's discussion, which is the first pillar will be about quarantine, the second will be about corruption, the third will be misinformation, and the number 4 will be returnees. Under quarantine, when the spread of COVID-19 started in Afghanistan, there were a rivalry between 2 leading candidates of the election, and Abdullah announced a self-claimed government against Ghani. Ghani also misused the situation, and they announced the commission election announced him as the president. So this rivalry in Kabul, in that time, we had only 3 confirmed cases, but they quarantined Kabul as a whole city, which had very bad implications for especially for most needy people, for very poor people, those who depend on daily wage workers, those who depend on daily wage, very little income. We have millions of people who depend on their own daily income, and they don't have like the second source of income. That's government social support does not exist. So the implications were the prices increased exponentially, hoarding of products happened, the business people, they were hoarding all products, and the prices increased badly. And based on the reports from the AIHRC, UNAMA, Ministry of Foreign Affairs, the violence also increased among the families. The reason they were presenting for the increase of violence were the poverty, the unemployment, and all other factors that was reason of the quarantine. So I'm claiming that the quarantine was based on a political reason. Otherwise, we could have controlled the coronavirus spread in Herat province, which is, and also in the Nangarhar provinces. In these provinces, we could have locked down the cities, we could have controlled the returnees and stopped the spread of the virus. But instead of that, we quarantined the big city like Kabul with 5 million population. The second pillar that I want to focus on is corruption. Unfortunately, corruption is a common problem in Afghanistan. We are under one of the worst corrupt countries in the world with the very bad institutions. And then when the COVID-19 came, the outbreak happened, the health sector and Kabul municipality and the committee that was established to fight coronavirus was also got infected with corruption. Unfortunately, we got the report a few days back that the donated ventilators were smuggled to Pakistan. There were reports on the media. And in the logistics, there were huge amount of corruption. Poor quality medicine. For instance, we saw on the pack of the medicine that it's written like after 4 months it will be produced, but it was available in Kabul city. This sort of issues happened like under the corruption. Misinformation. Unfortunately, the government, the CSOs, they were not able to hold to protect people from the misinformation and fake news. It increased during the COVID-19 with a huge amounts. For instance, when the COVID-19 started, religious scholars started to deny and to spread the wrong interpretations against COVID-19. First, they said because Chinese have prosecuted Uyghur, that's why it has happened in China. They gave this sort of interpretation. Then after it was when it spread it further and further, there were several other interpretations, and they wanted to deny it and to ignore it and to reject it. And behind another issue was fake treatments. Like once it was rumored that the black tea can treat the coronavirus, so everybody started to drink black tea. And then there was another rumor that olive oil can really help that for the treatment. Then they said onion, then they said lemon. So the prices were increasing day by day on each thing. And then we had a homeopathic doctors came and claimed that I have the treatment, and this is the treatment. After testing, they found it that it's only drugs. They are using opium and other drugs in that. So the cleaning with chemicals, with a lot of people got sick because of the cleaning with chemicals at their houses. So all this misinformation happened during this COVID-19 in the country. And finally, returnees. Two things here: reportation and deport of Afghan migrants from Iran and especially Pakistan. These two countries, first, when in Iran, the COVID-19 outbreak was at peak, at high level. So people got feared, they were scared that many wanted to return to the country. So they thought they should they should run from the COVID-19 and come back to the country. And then some other were forced to leave the countries, especially from Iran. And that was also the reason that somehow they brought the coronavirus to the country. And this was another issue, but the consequences was also health concerns that somehow they brought the coronavirus to the country, and unemployment increased, unfortunately. We have thousands of people who are working in Pakistan, Iran, United Arab Emirates, and other countries, which because of COVID-19, lockdown, quarantine, these people have to return to home. And here in Afghanistan, there is no job for them. Here we also have the challenges and everything. So I just want to conclude my speech here as that these four pillars contributed to the situation that now we have very needy people are remained with no services, or the services are very limited. We have so many challenges. The official reports now it's showing around 31,000 people are infected with coronavirus. But when the testing level are very little, there are no enough tests of the people. If you give the test today, after 14 days, you will receive your test result. So, unofficial numbers will be far more high. So that's it. Thank you very much.
Thank you very much for restricting yourself to your time. Absolutely, you are correct to explain that the corona could have been controlled in certain areas, but the strategies of the rulers were not according to what it was needed at the time. And I also like to share the same what you said. A lot of fake doctors came up during this period, not only in Afghanistan, but other countries. Now, I can introduce you. There are three more speakers, and we have Renu Adhikari ji, Haroon Baloch, and Rashid-E-Mahbub. But now I will ask your neighbor country, Pakistan, Haroon Baloch from Pakistan. Haroon Baloch is a human rights defender and journalist by profession, currently associated with Bytes for All. Bytes for All is one of the first organization for digital rights in Pakistan, has done tremendous work, good work they have done. And he can speak, and he's there as program manager. He's also a PhD scholar at University of Malaya, Kuala Lumpur. Welcome, Haroon Baloch. Maybe you can relate some of the issues in Pakistan with Afghanistan, and you will have 6 minutes to start with. Then you will have another 3 to 4 minutes after the first round. Yes, Haroon Baloch, please.
Thank you very much for introducing me, and thank you very much Forum Asia and SAPE to invite me to contribute to this important discussion. Definitely, it is the time that we should discuss all these issues at the regional level, because it's something that I mean, our region is one of the worst in when it comes to discussing that how severe is the COVID-19 situation here, and how many patients we have been receiving, and how many people have the access to basic public health, and how the government's response is to meet or to mitigate the effects of COVID. So, I mean, it's very important and it's very timely discussion that we are taking part into it right now. I will say, like, unlike Afghanistan, where the situation we have just heard that it's very severe, where the government has a lot of challenges because of the war like situation over there, and then because of their infrastructure that this country has been going through this sort of challenges for like 4 decades now, and now they are also facing the challenge of returnees from different countries like Pakistan and Iran. So unlike Afghanistan, Pakistan situation is not that worse, definitely, because Pakistan has some sort of public health sector structures are available there, but we cannot rely on those at the same time, I would say, because it's very much there, but it's very fractured health system, and it's one of the worst in South Asian countries, and especially when we talk about the government spending, gross domestic spending, when it comes to GDP of the economy, then it's very unfortunate the government is spending only less than 2% of the entire growth, economic growth, but I mean, which is not very good, and it's far less than the average of the GDP spending of the South Asia, which I've heard that it's somewhere 3.6 or 3.8%. And when we talk about the health structures in Pakistan, so we need to understand the political dynamics as well, because Pakistan is a federation, and where provinces are autonomous, and the health sector was devolved to provinces, and every province is free to make its own decisions. So provinces has their own say in it, and they are trying to respond to this situation according to their own capacities and their own political vision. And then we have to understand that there is a central coordination committee that is available, that is functional right now at the federal level, who is coordinating with all the provinces. But then here comes the political dynamics, which they play very strongly, and then political the difficulties that exist between different political parties, they are also impacting the situation, because in the center we have seen that this government, who is very new to the governance, they don't have any prior experience of running a country, and like the way we have seen that they have driven the economy or different other sectors. So I mean, they are very poor in their experience, and in the provinces, like if I talk about the Singh province, so they have a much mature government who has the experience of not only running governments in the province, but also in the center. So they have their own strategy to meet. But if we talk about holistically, so we see that the governments or the public sector's capacity right now at the hospitals, it's to accommodate the COVID patient, it has surpassed. I mean, like almost all the big hospitals, they are overburdened. They have started rejecting the patients to accommodate into the hospital, even in these ICU, intensive care units. So they are also overcrowded. They don't have any more capacity to accommodate patient. And then on the other hand, when it comes to dealing with the patients who are in the critical need, and who are in the ICU, they are also facing difficulties to access ventilators, because ventilators in Pakistan right now, I was uh, I was discussing this same thing with some of the ministry officials in Islamabad. So they informed me that the available total number of available ventilators in Pakistan, only 46 to 47% are functional, remaining they are non-functional. And the new the government has although they have allocated some funds to purchase new equipments, but like it will take some time to come and like to purchase and arrive in Pakistan, so that they can like distribute to different health facilities. Here, I mean, all these situations. So, what we can do, or the government is thinking to respond to this situation? I think they are trying to include innovative ideas, uh, they have tried to use technology in this scenario when it comes to specifically when it comes to public awareness, because in this all entire situation, public awareness is very important. And unfortunately, Pakistan again has I mean they lacked in spending much effort to aware public in this regard as well. So, but now we have seen that government has been using telecommunication technologies as well to educate people. But I think it's quite late now, because the situation has gone too worse. Because if we talk about in numbers, so right now the COVID patients that are registered with government database, they are over 200,000, like 213,000 patients right now. They are registered with the government database. And then there are unequal access to healthcare system. Healthcare in Pakistan, it's again a very big challenge. This disease does not differentiate between the rich and poor. Yet the poor are like far less resilient than the rich in having tools such as access to private healthcare, better education, and maybe option to work from home. Because in this situation, a lot of people are sitting at home, and they're not going to offices anymore. Like I'm working with the NGO. The civil society has been following very strictly all these uh, uh, WHO and government of Pakistan's SOPs. So we are sitting at home, but because our organization are very supportive in that side. But if we talk about the poor people, so they cannot restrict themselves to their homes, because they depend
Haroon,
on daily wages.
Haroon sir, please sum
Yes,
up, and then you will have a second chance to come up.
sure. So I will end here, and then I will if I'll find chance, so that I can add into more.
Thank you very much. Uh, Fractured health system in Pakistan, Haroon says about it correctly. One of the lowest expenditure in South Asia on health is in Pakistan, and also the lowest average age is also in Pakistan, in whole of South Asia. And poor have suffered the most, as Haroon has just mentioned. So now I will request Renu Adhikari ji. Thank you, Renu ji, for joining us. Renu Adhikari is a human rights activist from Nepal. As a trained medical doctor, she served in different districts of Nepal. After completing MPH, she took the lead role of district health program in the capacity of chief district health officer. After serving to government for more than 10 years in different capacities, she resigned and established WOREC, WOREC, Nepal, and started her campaign for human rights and justice. She is member of CSHRN, Physicians for Social Responsibility, Nepal, and part of People's Health Movement in Nepal. She has done extensive work on women's health and violence against women, and has been instrumental by different policy changes in regard to health and women rights. She served 2 terms in UN Trust Fund against slavery as board of trustee, and at present time she is with the expert committee within Ministry of Women, Children and Senior Citizens. Renu Adhikari, welcome please tell us what's happening in Nepal.
Thank you, Farooqji, and thank you all. Good afternoon, everyone. Thank you for such a elaborated introduction. But please, although I'm in the expert committee as a member, but I'm there as a civil society. So please don't take me as a government person, because
Sure.
today I have a couple of elements which I think can give us a hope, kind of elements, endeavors by the Nepal government, which can give us a hope. So I will be presenting those. Yeah, thank you, SAPE and Forum Asia for giving me this opportunity. I know I have very limited time, so I will just jump into the discussion, what really today we wanted to have. One thing, today we are discussing about whether we need radical change in South Asia for the health or not. Kind of this is, or COVID-19 has given us the opportunity for this. I think, that what I took that. It's not only we are briefing what Nepal or our country is doing, but we are coming to the conclusion for that. So I think that, okay, maybe we should look that, okay, where we are, right? We are in the region where the 2/3 of our people, they live below $1. This is before COVID also, kind of. So now there is a tendency like, okay, to blame COVID-19 for everything, kind of, because of COVID-19, this didn't happen and this didn't happen. So one thing very clear that, okay, our health system, all South Asian regional health system is very fragile. Second thing, like, okay, almost 2/3 of the world population live in this place, and then there is a big divide between rich and poor in the country, right? I mean, in this region. And I always say that, okay, there is big divide between, kind of, we have a north and south, even within the country, big divide among people. There is big divide between countries, and there is big divide between and among people inside the country also. These are our context, reality, from where I really wanted to start. So now what, in this situation, there are a couple of things which I think becomes very, very important for us when we deal with the pandemic like COVID-19. That is one whole issue of geopolitical scenario. Kind of geopolitical scenario is also very much very important. Kind of, there are a couple of there are areas where only one country cannot deal. So it's very much very important that, okay, all borders, they come closer and then do kind of put their hands together to take the issue forward. So what happened in Nepal context is when I remember, kind of, I'm one of the public health expert as well. So I remember when we had first COVID case. So on that day, we all kind of sitting together with the government and then trying to find out, kind of what is with us and what is not. So that time we haven't had even PPE. We haven't had, kind of first case, sample case, we had to send to Hong Kong in order to get tested. So we were in that kind of very bad health infrastructure shape. No protective instrument, no material, no hospital. I mean, incubators, we haven't had even couple of incubators in the government. So from the zero, we started, from the scratch, we started to work. We means, why I'm saying that, okay, we were kind of people's health movement, and then a couple of us were in the civil society and then recognized as health right activists. We were very kind of, we were consulted by the government. Now, whether the government listened to us or not, that is another thing, but at least we were consulted, kind of. So we started the work from there. Now, immediately, as everywhere, I think in India that happened, in Pakistan that I don't know, but in India that happened, government suddenly announced the lockdown, leaving thousands of internal migrant workers without any help, kind of. They couldn't, so in Nepal, there were around a week, it was real panic that, okay, a lot of migrant workers, internal migrant workers with their small babies, and they started to walk long, 7 days, 10 days in order to reach. And then among kind of, in that population, definitely there were women, there were elderly, there were pregnant women, there were lactating women. So it was a mess, let's say. And then civil society filed the case, and court also issued, asked government, like, okay, this should not be done. We, civil society, we came out with a press statement, and somehow then government opened transport in order to take them to their respective places. So this whole in COVID-19, in Nepal, there are several examples. I have 6 minutes, that's why I'm rushing a little. So
Please go on.
COVID-19, what did really brought out all the deep divide between rich and poor towns, right? This is one thing, and then kind of always in our region, we have best medical services as well. Like in India, if we really look, the best medical services, but always difficulty for the poor people even to have the basic health services, right? And this got really kind of brought out on the surface during COVID-19. This one thing I want to put. And second thing, what happened in the geopolitical, our prime minister kept on telling us, like, okay, saying us, I mean people, Nepali citizen, saying that, okay, this 100,000s of migrant workers wanted to come in the country. They told that we have spoken with the respective countries, so our people will be taken care by them, and then we will take care of their people. But that didn't happen with in case of India. So we could see that, okay, thousands of Nepali people wanted to come home, getting stranded at the border, Inside, we haven't had that many. I think we were a couple of cases which were also, in a way, unfortunately or fortunately, I don't know, from the migrants or from the people who came from outside. So what happened? A lot of pressure on the government got built to open the border, and that was very necessary. Every citizen has right to stay, to come in the country. Border was open, thousands of people came, and government couldn't handle the quarantine. Our quarantine is, I can say that, okay, now things are improving after a lot of civil society pressure and all, but quarantine is a mess, right? A lot of difficulties with the quarantine. A lot of kind of pregnant. There was no basic services for the pregnant, and then kind of women who needed delivery. Gender-based violence got really increased, and children also, a lot of difficulties. Mental health issues has came up, and now suicide is increasing like anything in the country. So several issues came together, got coupled, right? And at the same, and corruption always, kind of when we started to ask to buy the, I will sum up. Corruption was also one of the issue. But we dealt the corruption, then you might know that, okay, then Indo-Nepal border issue came. Kind of this political deviation also took place, So now at this stage, what I say that, okay, the positive thing is, I see if we work properly, there is enough space, at least in Nepal, to improve the public health system of Nepal. And COVID has given that opportunity, because health is fundamental right, according to Nepal Constitution. I am very proud of with the Nepal's health policy. Now we have Nepal health strategy. Now, kind of just today, another committee got formed to develop another strategy. And this year budget has been allocated, kind of increase for the health. And
thank you,
priority has been given for the communicable disease control and other. So these are some of the areas where we, civil society, if we work, I'm not saying that, okay, things are perfect at this moment. A lot of issues are there, but at least, government recognize the role of civil society, and the recently formed National Directive Committee. So all these things, if we put together, if we work together, I think we can move forward, and then we can create this space to strengthen public health system of Nepal. Thank you, but we need to work really hard. Thank you. I'm so sorry for taking it.
No, it's okay. Thank you, Renuji. We were expecting Rashid-E-Mahbub, who was president of Bangladesh Medical Association. Unfortunately, I don't see him here. But I just like to say what Renuji said. We were consulted. You were lucky that you was consulted in Nepal. In Pakistan, Pakistan Medical Association and young doctors were saying something else. Government was saying something different. And there was always a contradictory, like Donald Trump came in front of the doctors, and so was the case of Boris Johnson. In Pakistan also, this was the case that doctors were not consulted, the representative bodies of the doctors were not in the loop. I would say just few things before I ask Anosh ji about Afghanistan, that COVID-19 has exposed the new liberal path in health system. It has totally made it absolute clear that public health is needed, not a private health. Unfortunately, in Pakistan, there was a process of privatization of the public health hospitals that was going on even in March this year, while the pandemic was on the rise. It was experienced in KP, the Khyber Pakhtunkhwa district next to Afghanistan, and it was repeated in Punjab. Doctors were totally opposed to it. And also, as you said, Renuji, that pandemic has exposed the real divide on class line in whole of South Asia. Poor are hit the worst, and we can see that the situation in India, and the three countries which are at this time in the grip of pandemic is Pakistan, India, and Bangladesh. We have some relief in Sri Lanka and in Nepal. Also, Afghanistan is on the increase at present time, as Anosh has explained earlier, that they could have. Oh, we have here Dr. Rashid-E-Mahbub. Dr. Saab, welcome. I have met Dr. Saab in Bangladesh. Please unmute yourself. Unmute your voice. We can't hear you now.
Now
Dr.
you can hear. Now
I
we
can hear.
Right.
Yes, we are fortunate enough to have Dr. Rashid-E-Mahbub in this webinar. Rashid-E-Mahbub, a retired professor of surgery, Bangladesh. He was in the past, he was elected the president of Bangladesh Medical Association and also a former president of Bangladesh College of Physicians and Surgeons. Since after retirement, he is working for the health rights of the people. At present, the president of Health Rights Movement of Bangladesh and convener Doctors Platform for the People's Health. Dr. Rashid Saab, welcome.
Yeah.
I have the honor and privilege to meet you several times.
Yeah,
And when
I'm happy to see you.
When I was not
I'm
feeling well,
pleased to
you took me to a hospital in Dhaka. Thank you.
Right.
So Rashid Saab, tell us what's happening in Bangladesh, because we
Right.
hear very sad stories from Bangladesh where pandemic is spreading like fire at present time. Rashid Saab.
Take it. Let me clarify first. This is an epidemic of most contagious type of and so it spreads and it takes the life. Now, what happens on 8th of March, the first case of coronavirus was detected in Bangladesh. Since then, a lot of things has happened. Then only one institution used to look after to identify or test it. That was a single PCR machine. Then on demand, people start shouting, and ultimately now it has come to 70. But another thing has happened. They have asked the private sector also to be there, and private sector is taking money for that test.
That's right.
So public sector and private sector. Public sector, it was free till yesterday. Now they are charging 200 per test. Till now, 7 lakhs has been tested. 7 lakhs corona case has been tested. No, 150 is affected, but test was done 7 lakhs. And at the same time, there are two ways. The first, when they come from outside, they used to check them in the airport. Most of our patients has come from outside, and mostly it is from the Europeans. The first burst is coming from the European contingent, not from China, not from Japan. So what happens initially? Definitely, the ruling, they used to think that it will not affect us because their number is small. Then on 25th, they give us leave to all the institutions, school, college, and everything. They have not said it's a lockdown. They have said it is a leave. So they leave, and they wanted to leave. So they have gone in the seashore. They are making holidays, and even the garments factories, they have also gone at home. After a few days, this confusion arises. Then how the life will be survived? Health may be survived. How the life will be survived? So conflict of interest, they again push the government, open the garments factory. So they were called on. Again, they were pushed off. So that makes a great mix-up, and since then it is coming up. Coming up today, that is we are finding near 4,000 to 5,000 cases every day, and mortality is 40 to 50 per day. But another thing is there, corona-like symptoms. Those who are suspected coronas, all are not tested. Every day, at least, say 4, 5, 10 is dying. So out of 2,000, what we have said, it may be more. Now, the government is trying to more stress on giving on the health, that is hygiene, wash, mask, and go on like that. So that is going on. Now, another problem has come, how to treat them. So 80% of the patient does not need hospitalization. Only 20% needs hospitalization. And out of that 20%, 5% needs the ventilator. So what happens? Those who are wanted to stay at home, they are allowed to stay at home. Online, they are taking the treatment. Online, they are getting the medical coverage. But when they are severely infected, then they are coming to the hospital. And what happens? Sometimes it was so big that everybody is fighting for the oxygen cylinder. Even the big thing is happened that makes the poor and rich all nearby, because the rich has never thought they have to be treated here. But another window has opened for these rich people, that is the government CMH hospital. Combined military hospital, they have a corona care center. So all the big shots, those who have a political or face, they are going there. But mortality, still it is there. So all these things has happened, and the civil societies every day are shouting that you can't do that, you go for this and go for this. And the corruption is also there. Now the Prime Minister has taken by himself to the issue. And here she has given 10,000 crore for Corona Fund. And at the same time, donor agencies are also given 4,000 to 5,000 crores. So fund is there. But the question of, you cannot get the things in the market. So market is a problem. So of my experience, the global traders, they are also making some money out of it. Say a machine which I used to buy $1 lakh, now it is going to 5 lakhs taka, because the transport problems and others. So all this thing has going on in Bangladesh, but still we should say another problem is coming on Eid. There will be a transmigration. So we don't know when it will go to the peak. We don't know. So that is a problem. So if it does not go to the peak, then it will not come down. So it is a parallel. At the present, what is going on? Another funny thing, that urban slum has got no corona. Urban slum is free of corona. Rural village is free of corona. So these are the funny things. We don't know what is the reasons for it. But at the present moment, there are projected things is that in Bangladesh, the infection may up to go 5 lakhs and mortality may go even more 50,000. So that is a projected one. Projected
Rashid Sab, we will hear you in the second round as well. So if you can sum up now, please.
So I am talking that, but the government, I should say, they have not cared from the first initially. They said it will not affect us. We are immune to it. But again, the Maulvi Sahib, it is a gajab from Allah. So pray for us. That is going on. So what we could say, we are not so bad, but the ideal model is the Kerala one. If we could adapt that.
So we will hear Kerala issue later. Thank you, Rashid-E-Mahbub Sahib. Now I will ask Syed Hussain Anosh Sahib about the governments in South Asia has literally failed to curtail, particularly in Afghanistan, Pakistan, Bangladesh, and India. Fortunate examples of Nepal and Sri Lanka. But we have also governments where a complete lockdown was done when there was one single patient. Look at Vietnam, look at Mongolia, and look at several other countries, even Thailand, few thousand cases only, and they have controlled this coronavirus. So what do you say, Anosh Saab, about the policies and strategies of the governments in South Asia and the similarities in South Asia where they adopted each other policies? I would just say one last thing. Also in Pakistan, the religious extremists said it is ghazab, it is a punishment to you from the God. I said, well, look, it is also gripping the young ones. What sin they have committed? And lastly, I will say, I am a corona survivor now. I remained 40 days in this room where I'm sitting now. I'm still in quarantine. And I made some videos because the government failed to tell people what to do. So I made some videos and they went viral. And I can report here that over 1.5 million people have watched those, particularly women at home. And they gave me so much praise that because of your incentives, fight back, challenges, accepting challenges, they are very happy. So Anosh Saab, over to you in Afghanistan.
Yeah, thank you very much. As we mentioned earlier, I think the main challenge that remains in the whole South Asia is the role of institutions. Our health system is almost broken. There is no investment. There is no plan, future plan for how to handle the situation. As I mentioned earlier, only with 3 cases, we started to quarantine the whole Kabul city with population around 5 to 6 million. And you have millions of people who depends on daily wages, and they can have income of like $1 to $2 per day, and they eat it in the evening. If you close the whole system, these people are sitting at home, and the government is not providing any sort of social support, even though they are providing some sort of social support. But huge corruptions are happening there. Like in Afghanistan, based on some information that I had, they allocated 1.17 billion USD to fight coronavirus. But, you know, in huge amount of corruption cases happened. It's not only in Afghanistan, and it's easily justifiable. They lock down all CSOs, they lock down the media, so nobody is reporting, nobody is watching, nobody is monitoring. But on other hand, the corruption is happening widely. And there is no control, there is no accountability mechanism. So I'll conclude that at the role of institutions in our countries, our health systems, it's not really, we don't have think tanks that can predict the situation, and they take some preparations. For instance, Afghanistan received donated ventilators, but it was smuggled to Pakistan. So you
right.
see, this regional cooperation also does not exist. Instead of like supporting the countries like Afghanistan in this sort of situation, where we have the most broken system in the whole region, we are like the ventilators, the donated ventilators were smuggled to Pakistan. So that's it. That's what I would conclude it. Thank you.
I would say that it's cooperation, corruption and
Okay.
cooperation, hands in hand.
All right. Okay. Before I ask Ranuji about your thoughts on this discussion, I would say that the strategies of the governments in South Asia has not really improved the situation, and it has gone worse. And the investment in health sector is not really increased, and it's a business as usual for them. It is nothing, as COVID has not happened. So in Pakistan, in the recent budget, there is no increase in the health. There is no significant increase in the health budget, and the new liberal policies are still on the agenda. So Ronuji, what do you say on the strategies
No,
of the governments
I
in
really
South Asia?
agree with you. I agree with you. You know, kind of our governments, the whole to some extent, I must say that okay, they got trapped by neoliberal whole agendas, you know, and then they don't want to come out of that. You know, that is at one point, because see, in Nepal also, and when I told it's not that rosy. In Nepal also, we started our lockdown when there were only 3 cases. Kathmandu got locked down, and I already told that thousands of migrant workers got stuck. And then we eased our lockdown when cases reached more than 5,000. Kind of. Fortunately, our recovery rate is also good, and mortality is quite low till now. We have 29 cases, so 29 deaths, whereas today I think 13,000 something positive cases, right? So this is one, definitely they started lockdown, they could have done better. But in Nepal, everything, you know, now saying that, okay, this India border, we couldn't do anything with the India border, and that all COVID positive cases came from India. So that is the thing. And then that what is being projected. So a lot of stigma on migrants, actually, on people who are coming out, because this has been considered that, okay, they are the one who brought. Second thing, look, another thing which came out very clearly, like in Nepal, I think nowhere in the world is like that, but in Nepal, children started to die with COVID. Children usually they don't die with the COVID-19, right? But in Nepal, we have a couple of cases of children dying. You know, but this is very important to look whether children are dying out of diarrhea, or dehydration, or coupled with COVID. You know, because there was one case, 2-year child died, and which very clearly died out of dehydration, because people, they didn't want to touch, and then basic health care services is not available. It was not available. So this is another area where we need to look. Third thing, I think our political leaders are clear, but whether they will react on that or not, it's the whole privatization of hospital, what that brought to. You know, because kind of private hospital in Nepal, there was a point when they denied that. They told that, okay, no, we will not open for the COVID cases, you know, kind of, and then they started to bargain with the government. You know, it took time in order to make them say that, okay, you are also part of this, you know, with all the packages. And third thing, which made very clear, that a privatization of medical education, because government was asking doctors to join, and then doctors were denying, because they said, oh, we don't want to die in the kind of whole our moral ethical values, you know, kind of that were challenged by due to due to this a whole privatization of medical education. Because in Nepal, who can study and who can go to the medical education till now? Those are the people from the higher class, you know, because it's a really expensive medical education. So this thing also we need to take. And so kind of to answer your question, I must say that, okay, definitely our government are failing, I will say, in spite of trying. Because in Nepal, I see there is a sincere effort. because I am involved in the process. That's why I know that it's the sincere effort. But a lot of non-cooperation from the private sector, private hospital, geopolitical issue. This is the COVID-19 is becoming a business. There's a mask which cost only 10 rupees. Now it's kind of, there was a time which cost 250 rupees. So this kind of business, and then how to deal with the business. And when in first round, when I told that, okay, when first lot of materials, when Nepal government wanted to buy, even Director General of the health services, were trapped into the corruption case, and there was linkages to the higher authorities. So all these things definitely is scary. One thing which I forgot, I know that okay, time doesn't allow, but still I want to say one thing in Nepal. What I'm afraid of, let me be very, very clear. Like okay, because there is tendency to kind of mobilize army, saying that civilians couldn't control quarantine, so kind of a very subtle push to bring army into the scene. Even Central Coordination Committee, there was two. Our defense minister is the central coordinator of this coordination. He's deputy prime minister. So kind of there was two. One was created by Prime Minister in leadership of Deputy Prime Minister, because that time Prime Minister was in the hospital. So and then another was like with the army. But now with a lot of pressure and all, definitely this became one. But there is very subtle tendency.
Thank you, Renuji.
Yeah, thank you. But public health system, public health governance is still, kind of is at stake, which needs to be corrected. And then this is the opportunity. I will again add to this. Thank you. I'm sorry.
I will let some questions after the two speakers make some brief comments. There will be ample time for questions, and they can come up and raise their hand, and we will ask them to speak here directly. And I would say, as Rashid Saab said, that private labs made a lot of money in Pakistan as well, from 7,000 to 10,000 rupees for one corona test they were carrying. And public sector corona tests were free, and they are still free. But one thing which I felt from your contribution is that in the initial period, which was crucial, our governments did not take corona serious. They made joke about it. They said it's like a flu, it will go away. It is only for people over 60. It will not do you anything. It's like influenza. So you must not be very much afraid of that. So the kind of consciousness which was needed in the beginning was not there. So I will ask Haroon Baloch from Pakistan. He has followed all these discussions in Pakistan about this, about lockdown, smart lockdown, curfew, and so on. So what does he say about the situation in Pakistan at present time? Ji Haroon Saab.
Ji, Farooq Saab, thank you. Yeah, actually, you have thrown a very good light, and you have very good eye on all these developments. And definitely, we are also going through all these challenging times where you are also affected with corona. Myself, I was also affected. My mom sitting upstairs, she's right now in the quarantine. I mean, situation is very worse right now in the middle of Islamabad, which is a capital, and we have seen that how lightly people have taken all this situation, all because of the misinformation spread, not only from the people around us who are interacting with us on internet, from different other platforms, but I would say that there were political people as well who are affiliated with the different political parties. They have also contributed to worsening this situation, because I have met people, I have interacted with the public representative in the parliament, because I frequently cover parliamentary issues, and I travel there. I went to a couple of sessions over there, and I've met those people, and they are like, I mean, so what? I mean, the situation is that they say Allah ko jaan deni hai. You have to give your
to
life
Allah.
to the Allah. So I mean, when you have to die, so you have to die. So that, I mean, they will not tell you in through the lens of Islam, that Islam has also taught us that we have to take care about ourselves. We have to protect our lives as well. I mean, they are spreading this sort of misinformation, and that has caused a lot of damage to the society. And right now, you have seen that cases have passed the figure of 200,000, and
Yeah, that's right.
and this is not the real figure, by the way, because we know that around
Absolutely.
us there are a lot of people who are suffering from the symptoms. And I mean, you know that the testing capacity of government is not that up to mark. If we compare the testing capacity with the overall population, which has 200 million, over 200 million population of Pakistan, so it's nothing. It's nothing. And if government, I hope that government will increase its capacity, then we will see that. I mean, right now,
The
if
real
it's
situation.
yeah, exactly. And this misinformation, I think this has played very a bad role in spreading in entire situation. And then I will also say, when it comes to responding to the situation, government has not taken the civil society's role into its consideration. You know the entire situation, what's happening with the civil society right now. It's a crackdown against NGOs right now in Pakistan. They are asked to re-register themselves with the government, and then they have offered them to go through the stringent security checks through the they have to pass through. And then when a civil society organization applies for the re-registration, so they will never issue the
Get one. That's
registration.
right.
And it's a big hurdle in the way of civil society that they can
Yes.
play a role. And then, like, you know, if there is any civil society organization allowed to take part in the COVID in the response activities, so then there is a coordination issue, that when they would connect with or they would try to connect with the
That's
district administration, they would never respond to their request.
Haroon sir,
Even if
there is some issue.
Hello, can you hear me, sir? Hello.
We can't hear you properly, so we will hear you later after during the question time. Thank you very much, Haroon Baloch sahab. You made some very good comments, and I'll ask in this round Rashid-E-Mahbub sahab that if he can tell about the attitude of the religious people towards pandemic, because we were told that this is God given, this is, you can't do anything. And where is corona? There is no corona. And I hear such stories that doctors are taking dollars to test you positive and so on. And most of the it was really the mosque before the Eid who pressurized the government to unlock the lockdown and so on. So Rashid Sahab, what's happening in Bangladesh?
No,
This,
Bangladesh, we are not up to that extent polluted by the religions taboo. Because initially the mosque was closed. They were permitted only 5 to open it. Even in last Idul Adha, everybody is asked to be at home. But big fear is then all the precautionary.
Idul Fitr.
Yeah, Idul Fitr.
Yeah.
So religion has got very little. I should say they have, but not up to that extent. So the religion taboo is not affecting these things. But there is a thing that it is a Allah diya to kya karega. That was there. But overall situation in South Asia, what I should say, our national budget is too small for health services. That was the thing. And whatever we have, we are not doing properly, using it due to corruption. And we are more interested to build the buildings, purchase the other things, but not the services. So what we need, that is to be restructured. This thing is not going to help us in this structure. One one idiotic thing was done by ADB, Asian Development Bank, in 1990. They have restructured the health system of the urban area in Bangladesh. And they have spoiled that one. And they have gone to the NGOs. Same thing has happened now, that government has asked the private sector's hospitals to treat the corona. And minimum costing is there, 3 lakhs to 1 million taka. So it is not for the poor people that they can go there. The civil movement is on that context is now going on, that in a situation like that, treatment must be free and it must be borne by the state. Every day it is coming on the talk shows in the medias, but government is going to very little things on it. And but anyway, there are some good things also. Government is supporting the poor peoples. And lastly, what we could say, a lot of people is leaving Dhaka because they have lost their earning, because they cannot stay here. They are leaving nowadays, and they are going toward the village home.
So migrant labor is an issue in Bangladesh as well.
No, migrant labor, whichever in the Middle East, they have some money on their parts. They are on the rural base. Government is giving loan to establish them there with short terms, soft loans, so that there is a sector is going on. But in Dhaka city, those people are small, say, shopkeeper or working somewhere, particularly in restaurants and others. They cannot afford to live with family. So they are going.
Okay, Rishi Saab, we will take some questions now. And I see Krishan Gautam from Nepal and Beena Selval. So can we hear Krishan Gautam's issue she wants to raise about the senior citizens? So Krishan Gautam, please say what you want to say.
Thank you, sir. Do you hear me?
Yes, we hear you.
Okay. Thank you, sir, for this opportunity. And I'm working on the rights of older people, especially the health rights and many other rights of older people that we are denied. We mean 60+ people. So, and nowhere in this presentation I heard about the reference to the older people. I'm raising this question because the disease started from Italy, when they said older people, they put older people in the last preferred person or last option because of their pressure on the resources that they need, or the testing or treatment equipment. So how was situation in our South Asian countries? In Nepal, as far as I'm informed, I'm not a health worker, but older people were simply denied to access to health services because of this lockdown situation and all that. And also as you was told by the presenter from Nepal, that it's not the road was not accessible to hospital, and private hospital denied to provide the services, and government didn't have enough capacity to take them. And whenever tried, we were always, older people were put as the expendable people who are the last priority. So I would like to hear from the...
Yes. Thank you, Krishanji. I would ask Dr. Renu if she could respond to this question.
Yeah, thank you. It's really very good question. And then definitely a lot of vulnerable group of people like women, pregnant women, lactating women, elderly, they had real difficulty to access healthcare during lockdown, and then now also they are having difficulty to access healthcare. That in brief, I already told. But to think that whether that is denial of a health right or that has been created by the situation, we need to very clearly understand. What I see like in government plan, there is special consideration for the elderly, but definitely yes, services, those were not available before COVID-19 for the elderly also. And then now that is getting more difficult. That is getting more difficult. I will answer only here. And definitely this is one of the issue which we need to consider strongly. Yeah.
Anosh, you want to say something on this? Anosh? Yes?
Unmute,
Are
please.
you on mute?
Unmute.
Please unmute. Unmute.
Dr. Renu already answered this question comprehensively,
Okay.
so I'll give the credit to Dr. Renu.
So, all right. So next question is from Bina Silwal. Bina, please go ahead. What do you want to ask? I would also say that you can raise your hand, but you can also contribute to the discussion. Ji, namaste, Bina ji. Ji, Bina ji, namaste.
I'm Bina Silwal, working with an organization named Kopila Nepal on women, children, and mental health issue. I have few questions. The first issue is the women or girls who are working in entertainment sector. They are badly affected due to COVID-19. Obviously, every people are affected, but they are not accepted by the family, not by the community, and they don't get any work, any job, and any support even from government. Therefore, they are most affected people. How we can raise their voice? That is first question. Second question is that is always come to my mind is that how long the coronavirus survive in the dead body. What I feel now, the policy of government asking to the people not to take their dead body for their funeral ritual practice. The coronavirus is not long lasting in the dead body. It may survive for 3 days, 5 days, or so on. Why government do not make different plan for giving the dead body for after a week or after 10 days when the virus is died, and then family can do the funeral work as per their culture? That is my second question.
Bina ji, 2 questions are enough.
Okay.
So let me ask Dr. Rashid-E-Mahbub.
Yeah,
Please.
There are two things. There are two things to do. How the funeral of the dead body is to be done there. There are different instructions given by the World Health Organization. Everybody is just maintaining it. So what we have done, we have trained a group of volunteers, particularly Anjumane Mohidul, those who used to dispose the unwanted dead bodies. We have trained them, and it is in the rural areas also. They take the dead bodies and do the funerals with all PE precautions. But the thing is that something has happened also. The relatives of those funeral patients, sometimes they refuse to take their dead bodies. So dead bodies disposal is there a problem. But anyway, there are a lot of things. How many the virus is surviving? That is a question. But nowadays they can maximum survive for 8 hours. But the vital one question I am raising to all: how these public health hospitals or private hospitals is treating the corona patient and the non-corona patient in the same campus, because that has created a problem initially. General health services were shuttered. Now it has come up because everybody was instructed to have a non-corona and a corona in a fever clinic's name. And after that testing, they can go to the corona clinic. But nowadays, what is going to happen? Nobody is going to touch the patient until and unless it is corona-free. That was the greatest problem facing by the patient in the hospitals.
Okay, thank you. Now we are fortunate enough that among the participants, we have Nalini Ratna Raja from Sri Lanka. And it's good to hear her also what's happening in Sri Lanka at present time.
Fine.
Nalini Ratna Raja, please go ahead. And after Nalini, if there is anyone from our participants from India, we would like to hear them as well if they want to speak. So they will have the priority right. Nalini, please go ahead.
Thank you, Farooq. Thank you. And it's nice hearing from all over South Asia. It's what happening with the health issue. Sri Lanka is considerably
I think
better.
Nalini
And
is
hello.
there, but there are some issues. So anyone from India want to speak?
Yes, Nalini.
Hello, I'm talking. Can you hear?
Yeah, I
Okay,
can
now
hear. I
Nalini.
can hear Nalini.
Okay,
We can
Nalini,
hear.
go ahead first, and then we will hear from India.
Thank you, and nice to hear from all of you what's happening in South Asia. In South Asia, considerably, Sri Lanka is doing better job, and we have kind of, in the within the community, the spread of COVID-19 virus is almost stopped for last 1 month, and all the lockdown curfew are lifted up, and we are moving within the district, and but still we were warned it could be we could be attacked by the second wave, but government has done a good job. Even though they did everything, the response was under military control, and the task force leader is a military, and the health sector secretary was military, newly appointed. At the moment, we don't have a government or parliament because parliament was dissolved on March 2nd. So now we are going to have election next month, August 5th, and everybody got a fever, election fever, not the COVID-19 fever or sickness. So all campaigns going on, and mud sliding attack going on. So we hope that
that is like a tradition in South Asia, but good to hear that there is some control in Sri Lanka.
Yeah,
I
it's
would like
control.
to
And
ask. Thank you, Nalini ji. I would like to ask Sridhar from India if he want to speak. Sridhar, please go ahead. And also, I would like to say that in the chat box, Forum Asia would send a link, and those who want to receive the monthly newsletter from Forum Asia, they will be sent by Forum Asia. So please look at the chat box as well afterwards. So Sridhar ji. Sridhar, can you hear us?
Hello.
Yeah,
hello. Now you are
Please go
able to
ahead.
hear me? Yeah.
Yes, we hear you.
Thank you.
Please go ahead.
Thank you, Farooq, and greetings from India and Environics Trust in Delhi. The situation in India is quite grim. The numbers are increasing very rapidly. We have, like yesterday, we clocked almost 20,000 new cases, and it is not reducing. So we have really a big task in our hand. Already we are more than 500,000 cases that have been there, and more the testing we are doing, the more the numbers we are finding. Also, we had a lot of people suffering because of the lockdown, and subsequently workers who had to migrate back home had a lot of trouble. And we also had loss of life in trying to return back home. The other kind of concern from India, which we are noticing, and probably in all other South Asian countries, is that there is absolutely no transparency in how the money is being used. For instance, in India, from multilateral development banks, that is ADB, AIIB, NDB, and the World Bank, close to about $8 billion have come, and the kind of documents you see say that they could have used it for expenditures from 1st of January. when there was no question of no any investments made on COVID, and there is absolutely no transparency in how the money is being spent. So these are concerns that we have, and it looks as if that until October, a lot of the activities, economic activities, are not going to be taking place in a full-fledged manner. So I'll stop here. Thank you very much for the
Thank you,
opportunity.
Sridharji. Thank you very much for telling us about the present situation. Now, I could say that all our speakers and participants are in agreement that there is a need of radical changes in our public health system. We need a universal free public health system, and for that, we need to change the priorities of the budget, and our government are still paying the debt at this time. This is criminal to pay debt at this stage when people are dying and corona is spreading like fire, particularly in three countries, Pakistan, India, and Bangladesh. And Pakistani government just paid $1.7 billion last week to IMF, and they have put almost 40% of the total budget for the repayment of the debt. So is the case where 18% of the total budget goes to the military expenditures. So I would say that we need to speak about reduction in military budget, more expenditure on the public health, on education, on transport, on residence, on the people, for the people. And I would like to ask our panelists now, just in 1 or 2 minutes, their last message, please. So I would start from Renuji.
Okay, thank you. My message will be: we need to really restructure our public health system, as you said, and this is an opportunity. Definitely, our South Asian government can come together, especially from Nepal. Without India coming together, we cannot move very far. So it's very, very important for us. Like we come with some initiative together with India government, and away from the health right activists, human right activists. I think this is our time to come together and then to start creating environment where government feels pressurized to kind of improve public health governance, public health system. I will stop here, because government should not go away saying that, okay, corona doesn't allow us to do anything, this is time they need to build the system, and then they can build the system if they work properly. Thank you.
Okay, I will ask Haroon Baloch from Islamabad, Pakistan, what he has to say, some final words. Haroon Baloch sir.
Ji, Farooq Saab, like all other participants, I'm also fully in agreement that we need the radical changes in our public health sectors. But what could be the radical changes? I mean, we also need to think about those as well. We haven't, like, unfortunately talked about, or we couldn't suggest what could be the radical changes as a role of civil society, because we have this role to suggest governments and to other platforms to talk about these. Definitely, universal public health is a basic right, and government has the responsibility when it comes to their international obligation, like sustainable development goals as well. We have committed, and then several other human rights instruments where the government of Pakistan is state party. But keeping the regional situation into consideration, what we have to offer collectively as a regional body, because in South Asia we have this platform of SARC, which is unfortunately dead. This platform couldn't deliver effectively just because of the internal politics of two countries, India and Pakistan. We have to resolve our differences, and right now, unfortunately, we are seeing again this agitation between these two countries in the middle of this crisis of COVID-19, that both the nations are ready to fight again on the borders. Like we have seen that Pakistani government has expressed a lot in these recent days that India is thinking to like attack Pakistan. And then we have also seen that the statements coming out from Pakistani Prime Minister where they are where he very stupidly he's declaring Osama bin Laden as martyr, Shaheed. So I mean, this sort of nonsense we need to give up, and then we have to come back and sit at the regional platform. There are good examples from the Nepal, from the Sri Lanka. We need to talk about those solutions. Why these two solutions cannot be replicated into India and Pakistan and Afghanistan and other countries. We need to find out. We need to talk about. We need to bring the transparency and accountability into our structures, because we know that billions of dollars are coming into Pakistan, India, Afghanistan, and other countries. Where they are spending, why they are not being spent to bring the radical changes. We need to talk about those. We need to explore where these expenditures are being spent, because I know at least one case in Pakistan where my Pakistani citizens are denied to give easy access to vulnerable communities when it comes to providing face masks. But on the other hand, I've seen that Pakistani government, not Pakistani government, but the military of Pakistan has donated millions of masks to US military. I mean, how stupid it is that Pakistani government is donating masks to US military. I mean,
and also to China.
And also to China. I mean, this is very ridiculous. We need to think about our policies.
Thank you, Baloch Sahab. You have raised a very important question of SARC. There was an initial meeting in March of all the heads of state. Unfortunately, Pakistan only asked Dr. Zafar, who is a medical advisor to the Prime Minister, to attend that meeting. There was another meeting afterwards, and there was a fund set up for SARC to combat this. But now the situation has turned around. There are military conflicts going on here. So one of the main demands we can say in this SAPE webinar to reorganize People's SARC as an alternate voice to SARC and demand an immediate summit of SARC to combat COVID and also the other issues. Now I will ask our friend from Afghanistan, Syed Hussain Anosh Sahab, what he has to say finally on this situation.
Thank you so much, Farooq Sahab. As we know, the situation, it will not be the final thing, the coronavirus. We have a lot of other crises and challenges, including cybersecurity. You will have human rights issues, all these challenges, global challenges that require global efforts and joint efforts to solve and to tackle it. Especially on this issue on the coronavirus, on COVID-19, I think the region come together and fight this together. For instance, we have very good capacity in India and Pakistan. They can assist Afghanistan. Afghanistan can become a market for them, for the medical treatment, for the medical equipments and all this stuff. For instance, now we have the very poor quality medicine in Kabul. It's written on the pack that for export only to Afghanistan, and it's the worst quality ever. So the CSOs at least can call that these citizens, they are paying for the services, so they deserve to receive the proper quality of the medicine. So this is something that we can start with. Or the regional cooperation, the crisis can be changed into opportunity. I mean, the cooperation of this region, the whole region, they can exchange the capacities. They can provide expertise to each other instead of competing with each other and so many other things that we have, unfortunately, the challenges. And for the Afghan government need to take serious accountability and logistics and services that they are providing in the health services. For instance, we had to, for one teapot, the cost was, the document was released by media, that they paid 10 times expensive one teapot compared to the normal price in the market. This is like the situation. And to the CSOs,
thank you,
of course,
Nusa.
just final word. to the
Okay, please.
CSOs, monitoring, advocacy, and of course, in Afghanistan, in our situation, the service deliveries should continue, and they should work on that to make the governments accountable. Thank you so much.
Okay, now we are coming to an end. After Rashid-E-Mahbub Saab 2 minutes deliberation, we will ask Devendra Adhikari ji from Forum Asia to sum up the whole discussion. So Rashid Saab, final words in 2 minutes, and then we will have sum up from Devendra ji.
There is a thing which has a gap. Universal health coverage was raised by the West to privatize the health system or education system. The original, we should say people's health, people's education.
Absolutely.
It is not universal or non-universal. So
it is
the right people's. It is the right of the people. Now, question from where the money comes, that may be a fund from where it will come within the nation that can be discussed. So the fund can be duly given there. But in the name of universal, in the name of liberal economy, privatization is not to be done on education, health. We will just, we have to register. Second, Modi साहब ने जो फंड मिला उसको SAARC से,
please in English.
The fund which was received by the government of India, Prime Minister of India, Modi, he has given it as a donation to other nations. And Pakistan has rightly raised the question that it must be under the jurisdiction of the SAARC Secretariat. It was not given to Modi. So these are the things you have to think. And lastly, our fight for the people's right, we should go ask the civil society to fight on that content, so that if we joined all together, Southeast Asia, then definitely there is a better prospect than if we go isolated to solve this problem. It is a regional.
Thank you, Rashid sir.
It must be a regional.
Thank you very much.
Policy. Thank you.
Thank you very much. Today's webinar is organized by SAPE in association with Forum Asia. And now here we have our friend, senior activist, Devendra Adhikari ji from Nepal, who will sum up the whole webinar. Devendra ji.
Thank you, Farooq bhai, for your wonderful moderation, and thank you all panelists for your, the wonderful presentation focusing on, the public health system in South Asia. So we have, the kind of, the consensus among us that we need the radical changes in South Asia to cope with this type of pandemic in the future as well. So because our South Asian government almost all fails to address this type of, the COVID-19 situation in South Asia, so that, the number of, the COVID-19, the patients, they are facing, the troubles, and they have not, even the ventilator in the hospital. So having said this, just I would like to, to highlight something that might insight from this discussion. That so looking at the panelists' views, I can say that in this situation, the policy of the South Asian government is not so friendly to address this type of pandemic. That is one thing. For example, if they have that type of policy that can address the situation, why the needy peoples have not get that of, the health service on time. That is the thing. And there are also, the issues of quarantine in each and every country. There is the issues of corruption, and there is also the issue of misinformation, and there is also the issues of, the poor management of the migrant workers who are stranded in the border area, who wanted to reach their, the place of birth. So most of the government fails to address this type of, the problem in this situation. So it means there is the fracture, the health systems in our South Asia. So I would like to, they draw the attention to all the stakeholders, particularly to the SARC. Then what will be the role of SARC in this situation? They have a fund, but our peoples are suffering. They have a fund, but our government is not getting that fund. They establish that fund. Then where is that fund? How that fund is using in this critical situation? Then people are crying on the road. People are crying at home, but our government is not properly responding them. But they are telling that they have a kind of governance. They said that they provided a good governance in their one country, but we cannot see that. They said that, but we cannot feel that. So to make that, our government to be accountable. So we have already talked about the people SARC issue. And that the SAPE, since long time, the SAPE, the discussing about the people SARC. Even Forum Asia, since long time we are talking about the establishment of the South Asian human rights mechanism in South Asia to create a kind of pressures to the government, to make the government accountable, to make the functional to the SARC secretariat in South Asia. So I think in coming days, so if we really want to the radical change in our public system, our collective voice is necessary. Our collective effort is necessary. Civil society, the engagement is necessary. So let's think about the people SARC. Let's think about the human rights mechanism to establish in the South Asia so that we can, the work together to create, the kind of pressure to the government and to make them accountable. Probably next webinar, we will be focused on the people SARC, significance of the people SARC, need of the, the establishment of the human rights mechanism in South Asia. So probably we will have that, the another webinar focusing on that. So thank you all panelists and moderators and even the attendees, the participants for your, the active participation and raising, the most important questions to challenge the panelists. So it is very wonderful session for us. Thank you all. Thank you for all of your time. So having said this, I would like to conclude this session. Thank you.
Thank you.
Thank you so much.
Bye bye. Shukriya.
Bye bye.
Bye.
Okay, Haroon Saab. Thank you.
Haroon, bye. Yeah, bye.
Okay,
Renu
bye
Didi, bye.
then.
Bye.
Thank
Bye.
you.
Bye. Rashid. Anosh, bye. Yeah, bye.
Bye.
Bye.